On this episode of the eClinicalWorks podcast, a dive into the juicy center of patient relationship management. We'll talk with practices that have been able to recover their time and maintain the ability to practice medicine on their own terms, and hear how you can put these tools to work in your own office. Last time, we noted that the traditional doctor's office doesn't necessarily have a revenue issue. Instead, what might be happening is their overhead has slowly crept out of control, and so the office must cram schedules full to bursting, which leaves them with little time to spend on what many consider to be the most rewarding aspect of healthcare, the patient relationship. The key, we claimed, was to make full use of patient relationship management tools to tip the scales in your favor. This is where it gets real. We aren't just going to paint a rosy picture of the idealized outcomes of what could happen thanks to the wonders of modern technology. This isn't a 2 a.m. infomercial. Before the end of this episode, we are going to present several concrete action steps that have significant, measurable impact on your office's time and revenue. And you won't just have to take my word for it.
Hi, my name is Sherry Crooker. I am the practice administrator at Gwinnett Center Medical Associates in Lawrenceville, Georgia. We have 4 providers, 1 doctor and 3 mid-levels. Internal medicine, we see anybody from 3 months old to 106. Actually, she's 109 now.
Sherry's office was being overrun by phone calls.
When we started with Patient Portal, we were getting over 500 phone calls a day.
Action step number 1 is to start publishing lab results to the patient portal. Now, this step alone has the potential to completely change the way your patients view their relationship with your office.
I would get messages, portal messages. Oh, I see my labs were posted. I have a question about so-and-so lab. Nowadays, it's like, I was there last Friday and my labs aren't posted yet. They're getting very spoiled, shall we say. And it's like, okay, so those of you that want them, I just sit there in a portal message and I'll post them. I'm an RN, so I can do that, but I'll sit there and post them for them and then send the message on to the provider if they need to address anything. And again, it's the provider getting the labs taken care of in telephone messages while they're already in their telephone messages. Those are the priority jelly beans anyway, or the telephone jelly beans. And we're interspersing the labs in there. Kill 2 birds with 1 stone, so to speak. Giving the patients that sense of almost control that, oh, I can look on my labs before the provider's even going to call me and I can have my questions ready.
In Sherry's experience, once the patients know to treat the patient portal as the place to view their test results, they become participants in their own healthcare. Not only that, but the conversation is more effective. You eliminate one message where the patient requests their lab results, and you eliminate the phone call or visit that would be required to discuss the results with the patient directly. In order to make this process truly efficient, set your results to automatically publish to the patient portal as soon as the results are reviewed by the office. If you're using eClinicalWorks, this can be done from the admin band under the patient portal settings within the lab settings menu. What's more, if certain results should never be published to the portal automatically, like tests to determine pregnancy or sexually transmitted diseases, you can configure individual lab and imaging orders to be exceptions to the rule from the EMR menu using the labs or imaging lists. The biggest benefit here is that you get a lot of bang for your buck, especially since you won't be spending any. That's right. Publishing lab results to the healow patient portal is completely free. But you know what isn't free? Last-minute cancellations and no-shows, and it's becoming more important than ever to keep that no-show rate down. Over the last several years, the rising cost of healthcare and a trend toward high-deductible health plans have led some offices to report a sharp increase in the number of appointments that just don't happen. Here's Dr. Gavini, a patient engagement pro from Michigan, to explain the impact that even a few no-shows can have.
Because the idea is to bring down the no-shows from 2 to 3 a day to 0 to 1 a day. I mean, we can never make it disappear, but we are able to bring it down substantially. So each patient that you make them come to the office instead of no-show, you are ahead in the game, so much so at the end of the year, when you tally the numbers, you are up by tens of thousands of dollars. You know, it might look like 2 patients is not a big deal, but out of 25, 2 patients represent 8% of the patient volume. if I'm not mistaken, I'm only paying like $25 a month, and I am able to save a lot of money because of the fact right now we are having about 25 to 30% of the appointments are made through healow, and it's growing very rapidly.
But the effects extend above that bottom line because no-shows represent a potential breakdown in the continuity of your patient's care. Patients may have gotten their care sooner at another location, meaning your office now has to spend time tracking down those care records, or worse, they may not be getting care at all. And that leads us to the second action step, to make sure your patients keep showing up. Using Healow Messenger, practices can send an appointment reminder via voice or text message. This service even lets patients confirm or cancel their appointment using an automated system that'll update your schedule with the new status. And patients love this interaction, as Dr. Salam Bullock, who has a busy pediatric practice in Raleigh, North Carolina, noted in an interview with fellow podcast host Aaron Ibrahimi.
It has been great in reducing our no-show rate. A lot of our patients may forget that they have an appointment or what time the appointment was, and they'll say, well, I got an email to remind me and I had almost forgotten, or I got the call. We did notice that if for some reason there was any issues with Messenger, and if the system was down for a couple of days, we saw that our no-show rate actually doubled.
Studies have reported that the farther out a patient's next appointment is, the more likely they are to be a no-show. We forget. We're human. I know I probably would never make it to the dentist if I didn't get those reminder messages. Fortunately, Healow offers several ways to bridge the gap. No dental pun intended. By sending appointment reminders. If you need a hand getting those appointment reminders sent out or want to explore some more powerful messaging features, eClinicalWorks has a team of people who are able and ready to help get your office going. Let your strategic account manager know that you need some help from the patient engagement team, or put in a request on our support site, my.eclinicalworks.com. Now, maybe the last two steps didn't seem like much of a challenge. If you've already checked those steps off your to-do list, then it might be time to take a more drastic step. One way to improve your patient relationships is to be available for your patients whenever they need you.
How much of your schedule do you publish through Healow? Is it 100% of the schedule, 25% of the schedule, a couple appointments here and there?
No, 100%.
100% of the schedule. So
100% of the schedule.
I'm a patient and I can just log into Healow anytime I want and look at all your availability and see what time works best for me.
That's right. Yes, except that we kind of block manually certain appointment slots for emergencies. So we always have about 5 to 7% blocked off just to make sure that we have sick patient access that day.
That's Dr. Gavini again, and he believes that he saves money on every appointment by allowing his patients access to his schedule online. Online booking is so effective that he's been able to reduce his staff needed to manage all those appointment calls, resulting in ongoing savings. He did mention, however, that he makes certain to keep some appointment slots reserved by not publishing them online, and this is to allow room for urgent appointments in case the day's already full. Dr. Gavini's not the only one who's been successful with this. During the 2014 National Conference, we interviewed Dr. Mark McNeil from Trillium Family Medicine in Asheville, North Carolina. And if you are looking to make online scheduling work for you, Dr. McNeil shared some detailed instructions on how to determine the optimum number of appointments to publish. And you can find that and other interviews on our YouTube page or on iTunes by searching for eClinicalWorks. The offices we mentioned have shown that making a stronger patient relationship can be achieved by making changes to the way in which your office communicates with your patients and with the amount of responsibility that you put in their hands. The steps we discussed in this episode will work with just about any patient engagement tools your office might be using. But Healow puts engagement tools into a unified package that lets users focus on relationship management rather than trying to figure out how all the pieces fit together. By doing so, your patients are better informed and better equipped to work as a part of your office team which has a positive impact on everything from patient satisfaction to office revenue. Our story doesn't end here, although this episode does. Next time on the eClinicalWorks podcast,
most people don't know that healow is actually available to them. If they knew it, they would certainly use it because everybody's looking for an appointment tomorrow and someone's canceling an appointment. How would you know that?
The biggest obstacle I think I had at the beginning was telling providers not to use the word email. Pee in the cup, read about healow.
We'll discuss why the idea of marketing applies to your waiting room and how to keep it from being your Achilles heel. If you want to share your own insights on the topic, or if you disagree with all of the information in this podcast, head over to our YouTube page and leave your comments. Send us an email at podcasts@eclinicalworks.com or post something on our Facebook and Twitter pages. I'm Adam Siladi, and thanks for listening.